Hypertension and ethnicity. Understanding variations in blood pressure among different ethnic groups. Welcome to our YouTube channel. In today's video, we delve into the fascinating topic of hypertension and its correlation with ethnicity. High blood pressure, or hypertension, affects millions of people worldwide. But did you know that the prevalence and impact of this condition can vary among different ethnic groups? Join us as we uncover the intricate relationship between ethnicity and blood pressure, shedding light on the factors that contribute to these variations. So let's dive in and gain a deeper understanding of the complexities surrounding hypertension and its diverse manifestations across various ethnic backgrounds. So before we get started, make sure to hit that like button, also subscribe to my channel. Hypertension, or high blood pressure, is a condition that affects individuals worldwide, but its prevalence and management can vary among different ethnic groups. Several factors contribute to these variations, including genetic predisposition, lifestyle factors, socioeconomic status, cultural practices, and healthcare disparities. Understanding these variations is important for providing appropriate healthcare and developing effective prevention and treatment strategies. It's important to note that while certain ethnic groups may have a higher prevalence of hypertension, individuals within those groups can still have normal blood pressure levels, and individuals from other ethnic backgrounds can also develop hypertension. These variations are based on statistical trends and should not be used to make assumptions about individuals. Here are some key points about hypertension and ethnicity. 1. Prevalence. Hypertension rates exhibit variations among different ethnic groups, and one notable example is individuals of African descent, particularly those with African ancestry, who tend to have a higher prevalence of hypertension compared to other ethnic groups. What distinguishes this disparity is that hypertension in individuals of African descent often emerges at an earlier age and tends to be more severe in nature. While the precise reasons for these disparities are multifaceted and not fully understood, it is believed that a combination of genetic, lifestyle, and socioeconomic factors contributes to these variations. Genetic factors play a role, as certain gene variations related to blood pressure regulation are more prevalent in individuals of African descent. Additionally, lifestyle factors such as dietary patterns, physical activity levels, smoking, and alcohol consumption can impact blood pressure, and differences in these behaviors among ethnic groups can influence hypertension rates. 2. Genetic factors. Genetic factors play a significant role in the differences observed in blood pressure among ethnic groups. Specific gene variations that are more prevalent in certain populations can impact blood pressure regulation. For instance, variations in the gene responsible for encoding the enzyme renin, which plays a crucial role in the renin-angiotensin-aldosterone system that regulates blood pressure, have been found to be more common in individuals of African descent. These gene variations can affect the production and activity of renin, leading to alterations in the body's blood pressure control mechanisms. Consequently, individuals with these genetic variations may be more prone to developing hypertension or experiencing higher blood pressure levels. 3. Salt sensitivity. Certain ethnic groups, including individuals of African or Asian descent, have been observed to display a heightened sensitivity to dietary salt intake. This salt sensitivity refers to a greater physiological response of blood pressure levels to high levels of sodium in the diet. When individuals with this sensitivity consume diets high in sodium, their blood pressure tends to rise more significantly compared to those who are less salt sensitive. The mechanisms behind this phenomenon are not yet fully understood, but it is believed to be influenced by a combination of genetic and environmental factors. For example, genetic variations may affect the way the body processes and regulates sodium, leading to a stronger blood pressure response to increased sodium intake. Additionally, cultural dietary habits, such as the consumption of traditional salty foods or the use of certain seasonings, can contribute to higher sodium intake in these ethnic groups. Consequently, it becomes crucial for individuals of African or Asian descent who may exhibit higher salt sensitivity to be mindful of their salt intake and adopt dietary strategies that limit sodium consumption. By understanding and addressing this specific sensitivity, healthcare professionals can better guide individuals towards dietary modifications that promote healthy blood pressure levels and reduce the risk of hypertension-related complications. 4. Lifestyle factors. Lifestyle choices, including dietary patterns, physical activity levels, smoking, and alcohol consumption, can significantly impact blood pressure. These factors can vary among ethnic groups due to cultural practices, socioeconomic factors, and environmental influences. 5. Awareness and treatment. Ethnic disparities extend beyond the prevalence of hypertension and also encompass awareness, treatment, and control of the condition. Certain ethnic groups may exhibit lower rates of hypertension awareness and treatment adherence, leading to suboptimal blood pressure control and an increased risk of complications. Factors contributing to these disparities are multifaceted and include cultural, socioeconomic, and healthcare system-related elements. Limited access to healthcare services, language barriers, cultural beliefs, and mistrust of the healthcare system can all hinder awareness and engagement with hypertension management among certain ethnic groups. Additionally, variations in health literacy, educational attainment, and socioeconomic status can affect individuals' understanding of the condition and their ability to access and afford appropriate healthcare. Furthermore, cultural norms and beliefs surrounding illness and treatment may influence attitudes towards seeking medical care and adhering to prescribed treatments. To address these disparities, it is essential to implement culturally sensitive healthcare practices, improve access to healthcare services, promote health literacy, and engage in community outreach initiatives. By addressing these barriers and tailoring interventions to meet the unique needs of different ethnic groups, healthcare providers can strive for equitable hypertension management, ensuring increased awareness, treatment adherence, and ultimately better blood pressure control and reduced complications. What do you think of our video? Let me know in the comment section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go. Thank you for watching.